find the terms of health insurance confusing. Too often I hear a client apologize for asking so many dumb questions or explaining or confessing that they really have no idea what to do or where to start. I don't want anyone to feel this way, ever. Let's get you up to speed with some key health insurance and ACA language to equip you with what you want and need to know. Hey everyone, welcome back to Health Insurance Sherpa. I'm Lisa Martin, guiding your health insurance journey. Today we're going to go over the key terms and definitions that will help you choose and use your health insurance well. Does it sound a little boring? Maybe. But stick with me for about 15 minutes and you will be much better informed and come away with at least a few pieces of gold, especially if you're starting your journey on Healthcare.gov now, the most overwhelming journey by far. I am so glad you're here and you found this podcast. Okay, let's dive in. We're going to cover 3 sections. First, the 5 core health insurance terms that everyone should know if you're on group coverage or individual ACA coverage. Those terms are premium, copay, deductible, coinsurance, and out-of-pocket maximum. The second section is the key ACA terms. And then section 3 will be more general terms and how to best take advantage of your health insurance. Okay, section 1, let's start with the term that people usually notice first, the premium. The premium is what you pay for your health insurance to the insurance company to keep it active. A lot of people focus pretty heavily on this, but I encourage you to go deeper and stay tuned as we get into the benefits, the differences, and the network for the available plans. The premium is just one piece of the puzzle. Let me ask you something. Would you buy the cheapest tires? Not for me. I go middle of the road and question the salesperson about quality and if they're going to work well for me for my driving conditions. So the lowest premium may look attractive at first, but what if your doctors aren't covered? What if you need a referral to see a specialist? Are those acceptable? Also, you may not have to pay the full premium. We'll talk about premium subsidies a bit later. Now, turning to the actual plan itself, let's talk about copays. Copays are fixed dollar amounts that you get to pay from day one. So some examples of a copay might be $25 for your primary doctor, $50 for a specialist, $75 for urgent care, and you usually have a generic copay as well. So for example, you might pay $25 to see your primary doctor. That could be a pediatrician or internal medicine or family doctor, even if the actual cost for the visit is $150. The insurance company takes care of the rest after that $25 copay. And they will vary between plans. These are just examples. Next, we have the plan deductible. This is the amount you pay before the plan starts covering most of your other care. You're typically going to pay 100% for MRIs, outpatient surgery, hospital stays. But keep in mind, as you're paying that deductible, discounts are going to apply. The insurance companies negotiate deep discounts with all of their in-network providers. Once you meet 100% of your plan deductible, usually you move into coinsurance. Coinsurance is when you and the insurance company start sharing the cost. For example, some plans will cover 70 or 80% of your covered services. That means you pay 20 or 30% of the bill. Again, these are discounted. For example, if you have a $1,000 bill, you would pay just $200. The insurance company pays the rest. Now we have one of the most important numbers on the whole plan, the out-of-pocket maximum. A lot of people think coinsurance can go on forever, but it doesn't. So the out-of-pocket maximum goes by calendar year for covered in-network care. It includes everything your plan's going to cover, including medication, the copays, coinsurance, the deductible. Everything stops when you hit your out-of-pocket maximum. For 2026 ACA plans, the maximum possible out-of-pocket is $10,600, but a lot of plans are less. This number is really important to measure your risk for the year. If you have a spouse or a child on the plan, the family maximum is usually double the individual out-of-pocket max, so roughly $20,000. Now, here's a part that a lot of people miss. The insurance company does not have an out-of-pocket maximum, just you do. So your exposure is capped, theirs is not. Years ago, it was like $2 to $5 million over the lifetime of the contract, but they don't have that anymore. So here's a pro tip. If you know somebody in your family is going to hit your out-of-pocket maximum for the year, look at the annual premium plus the out-of-pocket maximum, and then compare all the plans to see what the lowest total out-of-pocket is. Okay, let's move into section 2, the ACA terms. So first, what is ACA? It is the Affordable Care Act. This is a health reform law that was passed in 2010 but the major provisions, including the marketplace plans, began January 1st of 2014. You may also hear ACA plans called Obamacare, marketplace plans, or exchange plans, and they are on the FFM, which is the Federally Facilitated Marketplace. It's all really the same thing. So when can you enroll? You have two opportunities. Open enrollment happens every year beginning November 1st, and it usually goes through December 15th for January 1st effective dates. Sometimes they extend it through January 15th, but we just take it 1 year at a time. The next opportunity to enroll is during an SEP, or a special enrollment period. And you have to have a QLE, which is a qualified life event. So some examples of that might be if you have a baby, you just got married, maybe you moved to a different county because different counties have different plans and premiums. Now you have 60 days to apply when you have a special enrollment period. Now we know what the ACA is and when to enroll. This brings me to provider networks. This is really where you should start your journey. Decide which networks that are offered are going to work for you. Which insurance companies have all or most of your doctors in their network. Keep in mind, one company may have several different networks. So once you figure that out, just focus on those companies' plans and it will greatly reduce your options because having 100 plans to choose from is just way too confusing. So people often ask, can I keep my doctors? And that is why network matters. A plan only works well if your doctors, medication, and facilities that you want to use are going to be in it. For example, here in Scottsdale, Arizona, the nearest hospital, really the only hospital nearby, is Honor Health. So that would be an important factor to consider. Now, with ACA plans, network is also important because in Arizona, we have all HMOs. So you really have to stay in that network for coverage. Now, of course, all plans will cover you for a true emergency out of network, but it has to be a pretty big emergency. And not all HMOs require referrals, so they really work for a lot of people. I have some clients with some pretty chronic conditions, and they're working just fine. So ACA plans have very specific networks also. So asking your doctor if they take Blue Cross Blue Shield or United, that just isn't enough. The networks can have multiple networks, and most of them are really only for employer plans. Today, we're mainly discussing ACA plans and networks. Always check the exact network name. For example, here in Arizona, Blue Cross Blue Shield has a Focus network, Ambiter has a Premier network, Cigna has a Connect network, so you get the idea. Now, turning to two major components that affect your premium on an ACA plan are subsidies and CSR, cost share reduction. So a subsidy is a premium tax credit, and it's a premium discount that most people will qualify for. The government pays part of your premium, you just have to pay the net premium. This is what makes coverage more affordable. I've seen clients go from $600 to less than $100 once that subsidy is applied, so it really is always worth checking. Now, a lot of people ask what income is used. Well, it's called MAGI, or Modified Adjusted Gross Income. If you look at line 11 on your 1040 tax return, that is your AGI, your adjusted gross income. That is one way that you can get help to estimate what your current income is going to be. Also, you can ask your tax advisor for help estimating yours. I know some people have some pretty complicated taxes, but we're only looking for the best guess. They know that a lot of people are self-employed. I have clients that are real estate agents. They really have no idea what they're going to make, but you can make it your best guess. And then even if you're off, nobody's going to land usually on their income right on the money. So it's all reconciled when you do your taxes. So don't worry if your income's going to be a little higher, a little lower. That subsidy will be reconciled, and you might owe a little bit back, or you might actually get a higher tax credit when you file. So also keep in mind that even if you don't qualify for a subsidy or that CSR, you can still enroll. You just have to pay full price. So let's get into the CSR. This is another very important and sometimes overlooked or unknown term, cost share reduction. If you do qualify for CSR, you get lower copays, deductible, and coinsurance, and even the out-of-pocket maximum can drop pretty low. In other words, the plan may not only be cheaper per month with the subsidy, but it can also be more affordable when you actually use it. Now, here's the catch. CSR is only available on silver marketplace plans, so you have to apply on Healthcare.gov, and your income has to fall within a certain range. But while you're shopping, watch for that CSR. Now let's turn to health terms that will help you get more out of your health plan or help you use it more efficiently. So Section 3. First, let's explore the drug formulary. This is simply a list of medications by the insurance company for what your plan covers. If a drug is not on the formulary, it may not be covered or it could be very expensive. Formularies use 4 tiers typically, sometimes it could be 5 or 6, but tier 1 would be the low-cost medication, generics. Tier 2 is often the preferred brand drugs. Tier 3 is non-preferred drugs, and 4 is specialty drugs like something high cost or maybe an infusion. If you do take an expensive medication, this can be just as important as checking your doctors. One plan may cover the drug at a low cost, while another may put it in a high tier. They may have restrictions or not cover it at all. So on the formulary, you'll see terms like PA, prior authorization, or ST, step therapy. A prior authorization means your doctor has to get approval from the insurance company before certain services or medications are covered. Now, step therapy is something that you would have to try a lower cost medication before moving to the more expensive one, or your insurance company may not cover it. Next, let's get into HSAs. Most of you have probably heard of HSA. It's a health savings account. It's similar to an FSA, but it rolls over year after year, and it's an account you get to keep if you leave your employer. This allows eligible individuals to set aside pre-tax money for qualified medical, dental, and vision expenses, and this can be a really smart way to plan for healthcare costs. Maybe not now, but in the future. So something new in 2026 is that all catastrophic and bronze plans on the marketplace and off are HSA eligible. So this opens up a lot more options for people who want a low premium but also want those tax advantages. Before this year, HSA plan designs tended to have a higher deductible and no copays before the plan deductible, so this is a pretty big deal. Now they do, but only with ACA plans so far. Definitely check out my HSA podcast for more on why I call this the triple tax advantage powerhouse. Now let's get into the benefits of an ACA plan. They cover 10 essential health benefits. This includes outpatient care, ambulatory and emergency services, hospitalization, pregnancy, maternity, and newborn care, mental health, prescription drugs, rehab services, lab services, preventive care at no cost in-network, chronic disease management, and even sometimes pediatric services like dental or vision benefits. This is one of the biggest protections of ACA plans. So you know what's covered, you don't have unexpected limitations, and you won't be denied for pre-existing conditions. They're not going to ask you any health questions. Before the ACA, before 2014, maternity and mental health were limited or excluded from coverage. You also had a very detailed health questionnaire that you had to complete. Some people were rated up, they were declined, or you could have been approved. Now that brings us to the next term, SBC. This is a detailed summary of your plan benefits. What's covered in-network, out-of-network, is an authorization required? It's going to be specific. It'll tell you what the cost will be to see a primary doctor, a specialist, what if you need an MRI, the medication copays and tiers, and if referrals are necessary. So you definitely want to keep this document handy to refer to throughout the year. So that brings us to the EOB, the explanation of benefits. This will tell you exactly how your claim was paid. It could be medical or dental. So what was the billed amount for each service? How much did the insurance company pay? What was the discounted price? And lastly, what is the total cost for you? What is your responsibility? This might be what you owe the doctor or the facility. Review this document before paying the doctor or provider. This is very important, especially if you have an HSA plan where everything is going towards your deductible anyway, and they have to bill the insurance company first. You can get it from your member portal, or some companies may actually still mail them to you. Now, if you're leaving a job, you may be offered COBRA. This is something that the employer must offer you, all employees and their enrolled family members, to temporarily keep employer-sponsored health coverage. You can keep it for 18 to 36 months, depending on the reason. Each family member can elect it independently. A lot of people don't realize that just one person can elect it, or everybody. It does backdate to the day you lose coverage, and you pay the premium, usually plus a 2 to 5% administration fee. Premiums will vary with each employer since everybody's offering a different plan, and they might have different rates depending on the makeup of their group, what network and plan they choose, etc. Employers have to give you notice within about 2 weeks of a qualifying event, and then you have 60 days to accept the coverage, or you can reject it. A lot of times I tell people just sit on that COBRA letter if you don't think you're going to need coverage, because if you don't need it, you don't have to elect it, but if something comes up, it will backdate for you. So even small groups with less than 20 must offer it, but we call this mini COBRA or state continuation. So when I talk with clients, we usually come back to the same concerns. What are my options for health insurance? Which plan has the best price and coverage for me? What will I pay when I actually use the plan? What's the plan deductible? Are my doctors in network? Are my prescriptions covered? And do I qualify for a subsidy? That's really the heart of it, the cost for the insurance and the cost when you use it. The goal isn't to find the cheapest plan, it's to find the plan that fits your life, your budget, and the way you actually use healthcare. So I have a challenge for you this week. Find your SBC, review your health benefits, and find one way to improve how you use your health plan. Maybe it's learning the name of your plan's network, how to look up doctors, maybe opening an HSA, or seeing if you qualify for a subsidy. So thank you for spending time with me today. I really hope this made health insurance a little bit more understandable, and I hope you feel empowered to make a great choice and get the most out of your healthcare plan. Subscribe for more useful health insurance advice. Have a question or a topic or a suggestion for a future podcast? I would really love to hear it. You can also email me at lisa@ecafinancial.com.